Hello, everyone, and welcome. My name is Natural Love, Assistant Director for Community Engagement with the Office for Community and Civic Engagement at UNC Pembroke. Today, I'm via WebEx with Ms. Jalen Wynn for the Community Engagement Virtual Workshop Series. This series was designed to emphasize the community partner and student experience by providing networking opportunities and collaboratively engaging in strengths-based efforts to further support community partnership with UNCP student volunteers. Ms. Jalen, she is the Assistant Director of Health Promotion and Student Health Services at the University of North Carolina at Pembroke. She earned a Master of Public Health degree at East Carolina University, as well as a Bachelor's of Science in Public Health at East Carolina University as well. During today's presentation, be prepared to learn about the various services that Student Health offers, including virtual services, self-care resources, potential volunteer opportunities, and so much more. She will also be discussing the coronavirus pandemic. So I will turn it over to you, Jalen. How are you?
Good. Thank you, Natural. We'll just go ahead and dive right in.
Okay.
So just an overview of the presentation. So I'm going to be talking about who we are at Student Health Services, so introducing you to the staff, the basics of Student Health Services. So we're going to be going over immunizations, insurance, and what we offer here, our new telehealth services and virtual resources that we just added, COVID-19, and how to get involved on campus. So Ms. Cora Bullard is our Director of Student Health Services. Her last day was actually Friday. She's retiring August the 1st. We're still waiting on a new director to be chosen. But basically, the Director of Student Health Services is responsible for the total operations and budget for Student Health Services and oversees the whole department. Crystal Moore is our provider, and she is a nurse practitioner. She also supervises the nursing staff. And then I'm the picture on the right. I'm the Assistant Director of Health Promotion. I oversee the health promotion programs, basically anything dealing with nutrition, sexual health, healthy relationships, alcohol, and other drugs. And I do a lot of collaborating with on-campus partners. So we have 4 nurses. We have 1 RN and 3 LPNs. Jessica Locklear is our RN. She's also our web coordinator and is in charge of informatics, so she updates the website and things like that. Beth Locklear is one of our LPNs. She's our referral coordinator, so she refers students to their outside appointments and follows up on those appointments. Belinda Smiling is our immunizations coordinator, so she sends out emails and letters to students regarding immunizations, so whether they're compliant or non-compliant. And Jamie Campbell is our lab coordinator, and she orders the supplies for the labs and makes sure that the labs come back in the way that they should. Donna Clark is our administrative support specialist. So she does a lot of insurance and billing, and she also helps out Lucinda, who is our administrative support associate, whenever she takes a day off or if she goes to lunch. She assists students with their appointments and to guide them on their way back to the nurse's station. So like I said, Lucinda is the administrative support associate. She's the first face that you see whenever we walk into Student Health Services. She helps students check in, make sure they have the right insurance information, and answers all calls coming in, and assists with immunizations, health forms, their consent forms, and their telehealth forms. All of our staff do an amazing job, and they are a pleasure to work with. So the basics of Student Health Services. So we are located in the Brave Health Center. We are on the 1st floor. CAPS is on the 2nd floor, Counseling and Psychological Services. Our address is 113 Hawk Drive, and we are located in between the Health Sciences Building and the Courtyard Apartments. We are open from 8 a.m. to 5 p.m. Monday through Friday. And so with that being said, we're always here. Everyone in our building is essential. We're mandatory employees. So the past 2 years, whenever we had Hurricane Florence and Hurricane Matthew, we were here. So we're not closed unless university is closed. So we're always here 8 a.m. to 5 p.m. Monday through Friday. There is our office line listed below and our triage line. So that triage line, students can call that if it's after hours. It's through our health link, and so you can call after hours to that number to get assistance. And if it's an emergency, always dial 911 or the UNCP Police and Public Safety Office. So immunizations, this is a big one. I don't have all of the immunizations listed on this slide because there's so many, but you can find it on our UNCP website. So we would like to have everyone's immunization records prior to the first day of class, but if for some reason we don't have them, then we give students 30 days prior from the first day of class to provide all of that missing information. And if that missing information is not provided after the first 30 days, then students will be withdrawn from class. So it's extremely important to have those immunizations on file. This does not apply to students registered only in off-campus courses, students attending night or weekend classes only, and students taking a course load of 4 credit hours or fewer and residing off-campus. So if you have trouble trying to find your immunization record, I would say check with your local medical provider, health department, or high school, and they may have those records for you. And like I said, a list of all the immunizations required is listed on our UNCP website, which I will mention at the end of the presentation. So student health insurance, that's also a big one. So all registered students taking 6 or more credit hours are required to purchase a student health insurance plan with the following exceptions. So if you're a distance education student, you don't have to submit that student health insurance. And if you're a student who submits evidence of equivalent coverage, so for example, a student who may be on Blue Cross Blue Shield through their parents, just make sure that you waive out of that student health insurance. So if you don't submit a waiver online, you will automatically purchase the student health insurance and the charge will remain on your student account. Students that do not submit an approved waiver and have not enrolled themselves in the program will be enrolled automatically. So the rates for the 2020 to 2021 academic year is $2,616.80 per year and $1,308.40 per semester. So like I said, if you have health insurance, I would highly recommend that you go ahead and waive out of that so you would not be charged. So here are just some of the list of things that we offer. I won't go through every single one of them. We offer a variety of services to our students. Students enrolled at UNCP pay a student health fee, which covers access to health professionals, health education programs, and events. It also covers co-pays and deductibles. So when you're a student here and you're paying that student health fee, you get access to all of these things and you do not have to pay a co-pay or deductible whenever you come in here. One thing that I want to point out is that gynecological exams are by appointment only. So, you can't just walk in and ask for a gynecological exam. You have to make an appointment to do that. Another thing that I want to mention is that your medical records are completely confidential. Unless you provide written permission or you're 17 years old or younger, we cannot disclose information to anyone, including your parents, friends, or professors. But if there is an emergency, parents and guardians are notified. So I just want to point that out. Any questions so far? Good. Okay. So all visits to student health services are free. So like I said, no co-pays, no deductibles. You're paying that student health fee. Students referred for hospitalization, specialty care, and diagnostic services not offered through student health services are responsible for the cost of these services unless it is covered by health insurance. So any medications or tests that are ordered are sent out with your insurance information, and the remaining balances are your responsibility unless it is through the student health insurance. So just keep that in mind. We do not offer emergency contraception. So, for example, Plan B, that kind of thing is available over the counter at most drugstores. We do not offer x-rays. Pharmacy services, I have a star by that just because we have a limited pharmacy in the back. Amoxicillin, polysporin, Phenergan, ibuprofen, lidocaine jelly, things like that we have back there, but it's not a full pharmacy service. That's why I have a star by that one. Also, excuses for classes missed after the class has passed. So a student can only get an excuse from class when they see the doctor or nurse before class is missed. So just keep that in mind. You would need an excuse before. And physicals, I also have a star by that one as well because we do offer student teaching physicals, but not any other kind of physicals. So, we can't offer physicals for athletes or, just anybody that wants to come in and get a physical. It has to be for student teaching physicals only. Our telehealth services. So this is something new that we began whenever, sorry, that conference thing is doing again. We began virtual care visits via Cisco WebEx or traditional telephone calls on Monday, March 23rd. So please be assured that we can offer many non-urgent concerns through a virtual visit, but you have to be in North Carolina physically to have a visit through us with student health services. Thanks, Sandy. So if you're not in North Carolina, you can go to MD Live And I have the instructions listed here. And so that's through Blue Cross and Blue Shield. So that includes telehealth services from ND Live. It's a good option for minor health problems when you can't see a regular doctor, and it's often more convenient and cost-effective than urgent care. Any questions on that? So basically, just to sum that part up, we might have some students in the fall who simply don't want to come into this building just because they're afraid to, like they might think it's the sick building. So telehealth services may be the best option for them, especially if it's something minor. They may just want to talk to our provider on the telephone or through WebEx, so they don't have to actually come into the building.
And I do have a question, Daylin, and I feel like I already know the answer to this. But how effective have you all seen your telehealth services to be?
Oh, yeah, they've been really effective. We actually have a survey that goes out to students every time they complete a telehealth visit with us. So I want to say we've had quite a few people. I want to say maybe 15 to 20 have used telehealth services already. So, yeah, it's pretty good. And we also receive good feedback as well. Sandy, I see your question. It says, how often is the provider at your location? So Crystal is here Monday through Friday, 8 to 5 as well, unless she, is sick or calls out, but she's here every day as well. All right. So we have other virtual resources as well. So we started a Wellness Wednesday when COVID-19 started. So what we did was we put it on Instagram. That was our main platform, but it was also on our Facebook story, and we promoted it on Twitter as well. So some of the things that we talked about during our virtual Wellness Wednesday this past spring was alcohol awareness, sexually transmitted infections, de-stressing for final exams, and sexual assault awareness. And so we plan to offer this program in the fall. I hope for it to be in person, with some of our wellness ambassadors, but if not, then we're going to do it virtually again, probably through the same format as the spring Instagram. College Health TV, that's a new feature that we have on our website, and I'm really excited about this service. It's America's #1 college health TV streaming service, and it's basically a student-focused video library, and it focusing on current health topics like COVID-19, skin health, oral health, fitness, all kinds of stuff. And you can access College Health TV by going to our website, and it's on the side, on our sidebar, and it says College Health TV on there, and you can just click on it from there. We also have some coronavirus information on our website. So, other than the UNCP official response and resources, we at Student Health Services have a self-care video that we have linked and a few infographics that are featured on our website. And I also have our Twitter, Instagram, and Facebook information, and Natural knows what I'm about to say because we talked about this the other day. We have a pretty good amount of followers on Instagram and Facebook, but on Twitter, when I got here, I realized we didn't have Twitter, and I just got here in March, so I was like, well, maybe we need to create a Twitter account. And I feel like we only got 5 followers, so I'm struggling. So if y'all have a Twitter account, y'all can go follow it right now at UNCPSHS.
I love it.
Yes, I need it. And I feel like, it's because, the coronavirus, a lot of students obviously weren't on campus, so I haven't been able to promote that very much. But once the students come back, I'm definitely going to push that because we need those followers. But Facebook and Instagram, we're doing pretty good. So just trying to get Twitter running off the ground. So some updated information from COVID-19. So COVID-19 is an airborne disease, so it's very easy for one person to pass it along to another person. Most people are unsure where they got it from just because it's so easy to spread. So back in March, the CDC was saying fever, cough, shortness of breath. Those are symptoms of COVID-19. Now, as time has passed and people have done more research, there have been a new list of symptoms added as well. So not just cough, but congestion, runny nose, difficulty breathing, chills, muscle pain, sore throat, new loss of taste or smell, nausea or vomiting, and diarrhea. And you can get these symptoms 2 to 14 days after exposure to the virus. One thing I want to point out is you can be asymptomatic and have the virus. So asymptomatic means that you can have the virus, but you're not showing any symptoms. So I may not feel sick because I'm not showing any symptoms, but I could walk around and be talking to you without a mask on, and you don't have a mask on, and then, my droplets are going in your face, and then you're automatically infected because I would have it. So it's just very important to wear a mask, and I'll get into that in a few minutes. But yeah, so some people can be asymptomatic and not know it. Oh, wrong way. So who is at risk? So older adults are at risk and people with severe underlying medical conditions. So what do I mean when I say older adults? So older adults, obviously the 65 and older population, they are at risk, but that's not exactly what I mean when I say older adults. So for example, people in their 50s are at a higher risk for severe illness from COVID-19 than people in their 40s. People in their 60s and 70s are at a higher risk for illness than people in their 50s. So that's what I mean by older adults. People with severe underlying medical conditions, what I mean by that is, people with chronic health conditions like heart disease, lung disease, diabetes, obesity, that kind of thing. So those two are at risk. That's what the CDC is saying for now. But I also wanted to add in who should take extra precautions. I saw this the other day when I was on the CDC website, and it's fairly new, so I wanted to share that with you all. So racial and ethnic minority groups, they should take extra precautions, certain ones. Certain health and social inequities between different racial and ethnic minority groups can put them at an increased risk of getting COVID-19. So these inequities that I'm talking about include living conditions, working conditions, health and socioeconomic status. That's no surprise. It's always been that way. But specifically, non-Hispanic American Indians and Alaska Natives and non-Hispanic Black individuals are more likely to be hospitalized from COVID-19 than any other race, followed by Hispanics and Latino individuals. So I just wanted to point that out there. Also, people experiencing homelessness. So homeless services are provided in crowded settings. Homeless people may be in crowded settings, so that makes it easier for them to spread infection. So they should take extra precaution. People with disabilities, so people who have limited mobility or who can't avoid coming into close contact with others, or people who may have trouble understanding or practicing preventive measures like hand washing and social distancing, they may be at risk. People who may not be able to communicate those symptoms may be at risk. So that's why those people with disabilities need to take extra precautions as well. People with developmental and behavioral disorders. So most people with developmental and behavioral disorders are not naturally at a higher risk for developing COVID-19, but people with those disorders who have those severe underlying medical conditions that we were talking about may be. So kind of, similarly what I was saying with people with disabilities. So maybe some people with developmental and behavioral disorders may not be able to, understand those preventive measures that I was talking about, and they may not be able to communicate those symptoms of illness. And also pregnant people. So pregnant people may be at an increased risk for severe illness from COVID-19 than non-pregnant people. So I just wanted to point that out there as well. So I thought that was really cool that the CDC put that on there because, I wouldn't have known that information unless I, went on there and looked at it. That's why I always encourage people to, just stay informed and go to the CDC website because they're always updating it and it's always some new information on there. Any questions so far?
I just think it's interesting more so than anything, Jalen, especially like you said, just with pregnant people or just different groups. Like I don't know, like it was something. I know me and you talked yesterday, but just kind of hearing it again, it's like wow, like we see and know only the ones that maybe have been shared with us already, but I think like you said, kind of doing our own research and saying, oh, okay, didn't know that this was also a population that could be affected. So I think this is, great information, especially as I'm thinking about, just some of my friends. Like I have a best friend now who's pregnant and, just saying like, oh, wow, but also not even a chance to for us to be like educate and make ourselves more aware, but also the people we're around because, I think this information is vital to everybody.
Right.
So thank you for sharing it.
Yeah, no problem. And, I think it's definitely a difficult time for pregnant people too, just because they can't have, maybe they want their mom and dad and their, partner in the hospital with them whenever they're having a baby, and that's just one person. So it's very difficult. But yeah, thanks for that. So how can you prevent yourself from getting sick? So number one thing that I would say, other than wearing a mask too, wash your hands often for at least 20 seconds with soap and water. If soap and water is not available, use a hand sanitizer that has at least 60% alcohol. Avoid close contact with others. So I would say, about 6 feet apart, and still wearing the mask. Cover your mouth and nose with a cloth face cover when you're around others. So like I said before, you could spread COVID-19 to other people even if you don't feel sick, and that's why it's important to wear a cloth face mask covering whenever you go out in public, like if you're going to the grocery store or to pick up other necessities. Cover your coughs and sneezes. So if for some reason, you don't have a mask or a face covering, remember to always cover your mouth. Like if you're gonna, maybe you could turn away and cough into your elbow or cough into a tissue and then throw that away. Clean and disinfect frequently touched surfaces. So for example, doorknobs, tables, light switches, countertops, your phone, keyboard, toilets, those kinds of things. Make sure you clean and disinfect those every day. And just monitor your health. So watch for fever, cough, shortness of breath, all those other symptoms that we talked about. Just make sure that you monitor your health every day and watch for those symptoms. So I just wanted to point out, as of today, I'm not sure what the numbers are going to be this afternoon, but as of today, Robeson County has had 1,334 positive test results for COVID-19 with 40 deaths. So I want to ask you all, what do you think we can do better as a county or, as a university community? What do you think?
I think, Jalen, really, like you kind of going back to that awareness and education piece, just like making sure that we're all aware. But I also think that goes like in, what Sandy said too, educate. I agree. Because I find too, definitely with communication, because I feel like, how you hear one thing and then somebody will tell you something else. Mm-hmm. And it's like, you really have to do your own research these days just to know for sure. But not only doing your own research, but looking at like those credible sites, the sources, so like the CDC website. And I think it also comes with just encouraging others to do the same. I'm actually, I don't remember, he shared it, it was yesterday during one of our Snacks and Social Justice series that he hosted, and it was the 3 W's, and I cannot remember what they were, but when Sandy shared those, I was like, yeah, that makes so much sense.
Yeah.
There it goes. Wear, wash, and wait.
Yeah. Yeah, I really like that too. I've seen that on the North Carolina Department of Health and Human Services website. They have some really pretty cool infographics for that. And Sandy said, debunk myths. So yeah, a lot of people don't think the coronavirus is real. That could be an issue. I don't know. I don't know. But, like Sandy said, educate those people. It is real. People have died from it, so I think people need to take it more seriously. But, All right. So, how can I get involved? So, Student Health Services. Sandy said don't drink for us. Student Health Services hosts 2 blood drives per semester through the American Red Cross. Our next blood drive is September 24th, 2020 in the UC Lounge. And I just spoke with Sandy yesterday about, possibly thinking of some more ways that the students can get involved. And I'm going to get back to him on that probably next week. We also have some wellness ambassadors as well through residential living. And so me and Cynthia talked about putting the wellness ambassadors in my department. So right now it's just for RAs, but next year, probably next fall, we're going to open it to more students as well. So that'll be another way for students to get involved with Student Health Services. And we're also, I'm in the works of contacting someone from Cape Fear by doing like an evening blood drive too, just because, with the whole late night and weekend programming, hopefully maybe some students will be able to do an evening blood drive if they can't make the one during the day because of classes. So, and I have our website listed below, our number, and our email. Does anybody have any questions for me?
I have a question, and this is more so about you, but what led you to the healthcare field or the healthcare area?
Okay, so I hope this won't be a long story. But when I was a freshman in college, I majored in psychology for like 2 months. And then we had like a required health class that we did. and I just really enjoyed it. And I knew I always wanted to go into the health field, but I just didn't know what I wanted to do. And so I was like, I'm going to change my major to public health. So I changed it like October of my freshman year, and I loved it. I loved all the classes I took, especially when I got into my major classes, because like when you're a freshman and sophomore, you take those gen ed classes. And then I decided, well, I'm not ready to go to work yet. I want to get my master's, so I'm going to get my master's in public health and see where that takes me. And I really enjoyed it. My professor offered me a graduate assistantship in health education. And so I taught a class, probably like 150 students, 6 times a week. And we talked about health education. We talked about alcohol, stress, basically everything that I talk about now. But now I'm doing programming, and before I was, teaching a class. And so I knew then that I wanted to go into the university side of public health, and that's what led me to my job now, just because I love health education and I love the university setting.
Thank you for sharing. Thank you.
And I see Sandy's question. What is your thoughts on how we should shift our students' attention to develop a holistic approach for health? I think, what I would say, and I feel like it's going to be, the obvious answer, but I feel like, just getting out there and doing fun things. I mean, just educating them on, certain health topics, but doing fun things with that as well. So not just like, the boring, like, well, this is what you should do, like, alcohol is bad, drugs are bad, that kind of thing. Obviously those things are bad, but you have to educate them in a more engaging way. And I feel like, when students connect with you and you're engaging with them on that more personal level, they'll start to really think about it and be more serious. Does that make sense?
Mm-hmm.
Yeah. Yeah, so that's my perspective on it. Because I mean, students know what's right and what's wrong, but I feel like once you connect with them on that personal level and they actually see it for what it is, then they'll, develop that more holistic approach, I think, if that makes sense. Mm-hmm. I hope I'm making sense. That makes sense in my head.
It makes sense to me.
Okay.
Sandy too. They went snap, snap.
Yeah, that's my take on it. Mm-hmm.
I guess another question I have too is, where do you see, like in your current role, or you probably be, the director by then, but I guess like what do you see for maybe the next 3 years? Like what do you hope for, like within your current role now is with Student Health Services? Like what do you hope for? What do you see for yourself or for Student Health Services as a whole?
Yeah, so we're getting a new director, so I feel like things are going to change. Definitely, it's going to be in a positive way. For myself, I am actually getting a certified wellness and health coach certification, and hopefully I should have that in the next year or so. And I'm going to use that certification to bring that service here to the students. So basically, wellness coaching, like if students are having problems with, they want nutrition advice or they want sexual health advice, things of that nature, they can make an appointment with me and we can talk about that one-on-one, and I can give them that advice. So I can give them what they're looking for. So that's specifically for me, that wellness coaching service, for sure. And I think, with the new director, and then, it's just going to be a really positive change in outlook. Yeah.
That's cool.
Mm-hmm.
Really cool. Good luck.
Thank you. Hopefully it'll be. I start the class next week, so hopefully but you have to like take the final exam and do all of that stuff. But I just also, being new here, I just want to see. I want to go above and beyond. I want to do something different that, no one else has done, as far as health education goes. So also for me, in that aspect, I want to grow as well.
Mm-hmm. Mm-hmm. Thank you.
Mm-hmm. Anything else?
I don't have any other questions. I was seeing if Sandy was chiming in with something else, but I don't see
Oh,
anything.
okay. Oh, he said he's
Right.
doing.
All right. Great job.
Thank y'all.
Yes, thank you so much, Shaylin. Like I said, you were probably one of the first staff members that I reached out to about this, and I'm just so appreciative that you always show up when it's stuff that that I've had going on. You're always there. You're always that one person just on our webinars or just attending our program and our events, and I just appreciate you for the work that you do now, and then the work that you've done prior, and then the work that you're going to continue to do within your role, and then you're going to be director one day over there. So, but like I said, I just thank you so much just for sharing your insights and all there is to know about COVID, about volunteer opportunities, about student health services, because like I told you yesterday, like I did not know you all offered like pregnancy tests there. So that just, I know like if I have students coming into my office, and whether it's something student health services related, like, hey, I'm sending you right over there to talk to Jalen, to talk to someone in you all's world, and who can better assist them. So this was great education for me, and I hope that for any viewers who chime in and watch this archive webinar, that it'll be the same for them.
Thank you, Natural. I appreciate that, and thank you for allowing me to present today.
Absolutely. So for anyone who's listening or watching, special thanks once again to Ms. Shaylin just for coming in and presenting about all there is to know about student health services. Tune in with me again on July 8th from 2 to 3 p.m. I'm going to be talking via WebEx with Dr. Lawrence Locklear about bridging the gap and strategies for inclusive workplace, for bridging an inclusive workplace for UNCP students. Dr. Lawrence, he is the Director of Office for Student Inclusion and Diversity. So if you all are free, join me then, and I will see you all soon. Thank you again, Jalen.
Thanks, Natural. Have a good day.
You too.
Okay.